Female athletes are 2 to 8 times more likely to develop an ACL tear playing the same sports compared to their male counterparts. This gender gap is an important topic, especially in sports like soccer, volleyball, and basketball. But why is there this difference, and what can the female athletes do to prevent ACL injuries? Hi, my name is Dr. Sanesh Tuteja, and I'm a consultant in arthroscopy and sports medicine at the Fortis Hospital, Mumbai. First, let us understand the ACL. The anterior cruciate ligament is an important stabilizing structure of the knee joint, and it prevents the excessive forward movement of the shin bone or the tibia during important sports activities like jumping while suddenly stopping or changing a direction. Unfortunately for female athletes, certain anatomic and biomechanical factors put an excess strain on their ACL ligaments. Some of these factors include an increased Q angle. The Q angle is the angle formed between the patella and the quadriceps tendon. Because females tend to have wider hips, their Q angles tend to be larger. This essentially translates into their knees moving inwards while landing from a jump, also known as the valgus position of the knee. And this position puts an excessive strain on the ACL ligament. Other factors include hormonal factors, where some research has suggested that estrogen can cause laxity of the ACL ligament. During certain phases of the menstrual cycle, when the estrogen levels peak, the ACL ligament could become lax and could not function optimally, putting them at an excess risk of an injury. Other factors include muscle imbalances, where some research has suggested that females tend to be quadriceps dominant. That means they rely more on their thigh group of muscles while jumping and while turning directions. The hamstring group of muscles actually support the ACL joint by pulling the shin bone back. So, this imbalance of the muscle puts an excessive strain on the ACL ligament. Additionally, certain neuromuscular factors also play a role. For example, it has been suggested that females have their knees straighter and less bent when they land while jumping, and this puts an excessive strain on the knee joint as compared to the muscles that take more of the load when the knee is bent. Uh, these factors combined put an excessive strain on the ACL, leading to more vulnerability for a tear. But the good news is that something can be done, and there have been studies which have shown that ACL prevention programs work in reducing ACL injuries by about 80% among female athletes. Introduction of these programs, especially among young female athletes before they hit puberty, gives them an opportunity to make the right adaptations that can help them prevent these injuries throughout their career. Additionally, the use of other strengthening exercises like core strengthening helps increase overall balance, and this also helps support not just the knee muscles but the entire lower leg group of muscles. To conclude, while female athletes may be at a higher risk of an ACL injury, understanding these factors and instituting appropriate training programs could help reduce their incidences. Thank you.